Bismillahirrahmanirrahim. This is Dr. Gufran Babar. Today's video will be on migraine headaches and headaches in general. And we would like to determine 4 easy steps to manage the migraine headaches. Migraine headaches are disabling. They are very common. In US, about 20 million people suffer from migraine headaches, which range from pediatric age group from 5 years onwards to old age. And it results in a lot of loss in revenue up to $30 billion. A lot of work is lost. The commonest reason to visit the ER is headaches. So it has got profound ramifications over the society, and identifying the headache type and treating the headache is very important. Headache in general could be divided into the primary and secondary headaches. The primary headaches include the migraine headaches, the cluster headache, tension headache, sinus pain, and it also includes the hormonal imbalance and headache. As far as the migraine headache goes, it is a disorder of recurrent headache which happens, which could be bilateral or unilateral. In children, it's mostly bilateral, and as they go into the teenage years, it becomes bilateral. It could last from greater than 2 hours to up to 72 hours. It can be associated with other symptoms, and the International Headache Society has given classification for that it is greater than 2 hours in duration, moderate or severe in intensity, associated with nausea, vomiting, photophobia, because the people are scared of visual symptoms, phonophobia, that is the light symptoms, could be throbbing in nature, unilateral or bilateral, both sides. So they could have headache more than 2 hours and about 2 of these remaining symptoms. And aura can be associated with migraine headaches, which is a feeling that something is about to happen. We will discuss migraine headaches in detail later in my talk. Other headaches like tension headache is usually a band-like headache on the forehead. Usually the commonest reason for which we take the pain medicine. It does not cause any other symptoms and is resolved with over-the-counter medications like paracetamol, naproxen, or ibuprofen. Cluster headaches, on the other hand, is a severe and persistent type of headache which can last several hours, which is around the eye. And it can involve the trigeminal nerve, which is the nerve that supplies nerve to the forehead, the mid and lower face area. It could be associated with Horner's syndrome. And what is Horner's syndrome? It may involve ptosis or drooping of the eyelid. It will be associated with constriction of the pupils. It could be associated with lacrimation, meaning excessive tear production, and nasal secretions would be increased as well. It responds to the triptans, sumatriptan, but those people who have cardiovascular disease should not get it. Sinus headache is over the sinuses on the face, and usually it is associated with nasal drainage, fever, associated with infection like sinusitis, and responds to the antibiotics and pain medicine. Hormonal headache is associated with estrogen withdrawal or lack of estrogen during menstrual cycles, happens in the females, and responds to hormonal therapy to prevent the estrogen withdrawal. Going towards the secondary headaches, which are the severe type, which are other types of serious headaches. Mnemonic of Snoop is used, which means they could have systemic symptoms, just like in brain tumors. They could have associated early morning vomiting, ataxia, which is the gait abnormality. They could have irregular or unstable gait. The headache increases when the child lays down, or in neurogenic symptoms like severe thunderbolt headache, which happens in aneurysm rupture or dissection of carotid artery. They could be rapid in onset, could usually be more common in older people, and they could have other associated symptoms like tenderness of the temporal artery, and there could be associated other systemic illness associated with it. Intracranial hemorrhage, which is sudden deterioration, sudden severe worse headache, which could be subdural, subarachnoid hemorrhage, is pathognomonic in that sense that you suddenly feel the worst headache of your life. Giant cell arteritis, which is in older people, where you can feel the tenderness over the temporal artery, could be present. Rupture of aneurysm, I already discussed, which will also be serious and severe headache. So migraine headaches are the headaches of a very, very sensitive brain. So usually there are triggers which are available, and those triggers will cause the onset of headache. And those triggers could be neurological, like stress, or emotional, like stress, sadness, excitement. They can trigger these headaches. Usually they are more common in females, 1 in 4 in women, 1 in 4 in women could be present, and which could be associated, or sometimes in 1 in 6 in females, could be associated with the hormonal imbalance. Tiredness can trigger this migraine headaches in the sensitive brain. Posture, tensions, low glucose levels, menopause, people who are shift workers, during travel, it can be triggered. Prolonged fasting or lack of food, irregular eating habits, people who drink alcohol can trigger headaches, and a typical history of person eating a cheese sandwich with caffeinated drink and eating chocolate following that. So cheese, caffeinated drinks, and chocolate could also be the triggers. Environmental triggers, a normal brain would not be having those triggers, but this sensitive brain of a patient who has a genetic susceptibility for migraine headaches, bright lights, loud noises, climate changes, stuffy atmosphere, sometimes medications like sleep medications, oral contraceptives can all trigger migraine headaches. And in migraine headaches, they could have a prodrome, which is basically symptoms before the onset of headaches. They will have some kind of symptoms, and a typical example is like a storm in the sea. So first the rapid winds, they kind of blow. So same is with the prodromal symptoms, that there is something gonna happen, so which could be change in the mood. The child may be, or the adults may be in fatigue, excessive food craving, yawning. So those are the typical symptoms which can be present in the prodromal phase. And then there is aura, which is basically that something is gonna happen. So those are the aura-like symptoms which can happen. And this aura could be either visual, that is the eye symptoms could be there, could be sensory, could be language, could be motor. And the pathophysiology, which has been described, is that in the past there used to be a vascular hypothesis, that there is first vasoconstriction followed by the vasodilatation, which causes the pain coming. So the vasoconstriction would cause the symptoms of aura, and the vasodilatation would cause pain. But in 1990s, with PET scan, we found that those vascular changes are not present. And then a neuronal hypothesis was developed, that there is a wave of neuronal depression that goes through, and that kind of triggers the migraine. And that neuronal wave could be associated with the decrease in blood to the brain, and which will be appreciated if you look at this rough picture, which indicates that this could start from the occipital lobe of the brain and go to the parietal, which has the sensory lobe, and then to the frontal lobe, which also has the motor area. So it can be started, that wave may start from here, may spread down to the locus coeruleus and the trigeminal nerve, involve the dura, which is dura, pia mater, arachnoid, and then the dura mater, which is the lining of the brain, has the pain fibers, which could be causing these symptoms. And the visual symptoms could be present depending upon the area of the occipital cortex which is involved. And the dural sinuses, you can see that this is outer area skull, and then the dura, arachnoid, and pia mater, and the brain itself. So this abnormal electrical activity wave of spreading depression then goes to the lower part of the brain, and then the nerves that supply these meninges will cause the stretch and will cause the sensations of pain in the head. And the aura is very critical, because people can identify it, and it can have visual symptoms in which you can have a blind spot in front of the eye. There could be zigzag lines, and those are the things that the patient will know. Sensations like feelings of pins and needles, which can be on the mouth, face, on the arm area, which are positive, followed by numbness, or sometimes they could have a paralysis, which could be from simple clumsiness to paralysis. And if that happens, you have to make sure you rule out the stroke. But usually in these people, there are 3 gene mutations which have been found. Language aura symptoms could be from speech, which is ununderstandable, dysarthria, and sometimes loss of memory, amnesia, and profound loss of amnesia can happen. However, loss of amnesia, speech problems, gait problems, paralysis should not be taken lightly, because they could be a stroke. While these visual symptoms that can last for an hour during the prodromal phase, and then they will resolve. During these phases after the prodromal and aura, then the phase of headache begins, and headache can last for several hours, and because of the abnormal electrical activity. It could be several hours a day, and several days a week, and can be up to 10 days per month. And if it is greater than 10 days, then it is chronic. And then there could be a phase of hyperalgesia during this headache phase, in which you are very sensitive to touching the face, laying on the pillow, and even combing the hair. The people are really in great pain. And if it lasts more than 72 hours, these people could be in status migrainous, which is persistent migraine, and serious treatment is needed. Following this phase of headache, there is postdrome, in which is like a hangover phase, or just like post-ictal phase in seizures. People can be in a state of fatigue, nausea, difficulty in thinking, which can last for several hours before it completely resolves. As far as the types of migraine headaches, they could be associated with an aura, could be without an aura, or just simple migraine aura could be present without migraine headache. Ophthalmoplegic, in which severe headache around the eye region, like cluster headache. Hemiplegic, like I said earlier, there could be paralysis of half of the body, and stroke has to be ruled out. Vestibular, which is associated with dizziness and vertigo, in which you feel like head is spinning all over, can also be present. So as far as the treatment goes for these migraine headaches, there are simple steps. If they are followed, the treatment can be done. One thing which I forgot to mention is in the pathophysiology, that serotonin is a very important neurotransmitter which is present in the brain, and its level is decreased, and then you become hypersensitive to all these stimuli. And stress is one factor which can release serotonin and can trigger migraine. And serotonin, the chemical hypothesis for migraine is that serotonin is involved, and the serotonin receptors are present all over the brain. They are also present in the meninges. So the scientists worked on finding a medication which is selectively working on the serotonin receptors, so that it can cause vasoconstriction and cause decrease release of mediators of inflammation in the dura. So not only it causes vasoconstriction, it also works on the nerve endings to relieve the symptoms. So in 1984, triptans were found or discovered, and those are the medications which are serotonin agonists. And people who have depression, anxiety, mood disorders, those medications which relieve those, they increase serotonin, their headache also improves. There is another thing which is called calcitonin, gene-related peptide. Its level is also increased in migraine. So there are antibodies which are developed to treat migraine headaches using antibodies against this calcitonin gene receptor proteins, and they have been approved in adults. So these are the few hypotheses for the pathophysiology. Is a wave of spreading neuronal dysfunction, serotonin decrease, hypersensitivity to serotonin, and people who oversleep during the weekends, their migraine attacks could be triggered. So the simple steps that I'm going to tell you are 4 simple steps that can be used to treat migraine headaches. Number first is the simple techniques to identify the triggers. So the most important thing is to write down the symptoms which are associated at the time of these headaches, and see which is one common event which happens time and again during these headache attacks. The first important thing is hydration. So drinking plenty of water, not missing meals, have a good sleep schedule, and doing regular exercise helps in preventing the migraine. Simple techniques, and those triggers could help us identify, like some people have food allergies, so they see that whenever I eat eggs, I develop migraine headaches. So avoidance of that Common other allergens are gluten, dairy, so they can be corn, they could be eliminated. So egg, dairy, gluten, corn, they could be eliminated and and you can see if the headaches resolve. Sometimes aspartame in diet drinks can trigger headaches, so you can avoid the diet drinks. And preservatives or processed foods, so go for the natural foods. Hormonal imbalance in premenstrual syndrome, oral contraceptives could be used to decrease that. Avoidance of alcohol in those people. If people who have extreme irritability, palpitation, appear stressful, it has been found that magnesium replacement can decrease their headache attacks, and magnesium gluconate 500 milligram once daily is routinely used in those people. Other things like mitochondrial disorders, urine organic acids can be measured. CoQ10 and vitamin B2 are the supplements which can be used for headache treatment. So other than these physiologic things that I have mentioned, the food avoidance includes cheese. Like I remember I said someone eating a cheese sandwich with a caffeinated drink and eating chocolate later. All these things can trigger it and trigger migraine headaches. Sometimes strong odors, they can cause triggering of neuronal activation and causing migraine headaches. As far as the other treatments, in the beginning you use the first line of medications is the non-steroidal anti-inflammatory drugs, which include paracetamol, ibuprofen, that can be given. Diclofenac sodium, naproxen can be used. And other miracle drugs, which are triptans, the serotonin receptor agonists, they can be used, including sumatriptan, Imitrex, elmotriptan, rizatriptan, which can be useful, and they have to be taken in consultation with your regular doctor or neurologist. And flushing can happen with these triptans, which are could be triptan effect, could have chest pressure, head tightness. So if those feelings happen, so you have to always take these medications in the presence of a physician, or less severe side effects causing medications like elmotriptan or rizatriptan can be used. And they have to be avoided in cardiovascular disease, people who have liver disease, people who have hemiplegic migraine, so they have to be avoided, and best given at the earliest onset. As soon as the patient feels there is an aura, the headache is coming, the sooner you give, the sooner the better. But if it is given later, it may not be effective, and limit to 2 doses in a day or 2 days per week. And in extreme so this other things which help in acute attack include antiemetics or preventing nausea, like prochlorperazine or densitron can be given, which is Zofran. And we also give diphenhydramine, which kind of relaxes the patient. And like I said, hydration is a very key thing. And these medications have to be started in low dose, and they have to be increased as tolerated. So lifestyle modifications we discussed, dietary modifications, and avoidance of triggers. Then the medications that we use is the first line of medications, but if the pain is profound, it does not respond to the triptans as well as to non-steroidal anti-inflammatory drugs, then you can use other stronger medications like barbiturates, butal, narcotic analgesics, but they have to be really, really, really avoided, and they must not be taken. But if someone is getting these barbiturates 5 days per month, opiates 8 days per month, triptans 10 days per month, non-steroidal 14 days per month, so the patient is really, really in bad shape, and alternative techniques should be used in those people. So those alternative techniques alternative medications which can also be used will include amitriptyline, which is an antihistamine. It can be used, and amitriptyline can be used to prevent the headaches, and which will it has to be, we have to be careful in people who have family history of prolonged QT interval, and if the dose is increased, an EKG should be performed. Topamax or topiramate is a good medication, especially those people who have other issues like seizures as well, but it can cause a lot of side effects, mood changes, numbness, tingling sensation can be present. Valproic acid has been approved for migraine headaches, but again, they should be taken in consultation with your headache specialist or neurologist. Magnesium, we already mentioned, has to be avoided in kidney failure. It helps with the constipation. So in extreme cases, you will use those narcotic analgesics or phenobarbiturates. Last step, which is the fourth step, is lifestyle modifications, cognitive behavioral therapy, because sometimes there could be rebound headache. The more headache medications you use, the more headache comes, and that is a big problem. So for those people, it will be advisable to learn the biofeedback techniques to avoid headaches. There is transcranial magnetic stimulator which is available, which can be used, biofeedback, mindfulness, self-training, pain management specialist can help with it, and the goal is to avoid the school disability in kids, and to work disability and the life events that happen in adults, to avoid all those things. So these techniques will help so that the child or adult can have as normal life as possible, and these headaches don't control the life of the patient. And remember, these repetitive headaches are profoundly disabling. So finding a trigger in a nutshell would be the key. If we can avoid the trigger, we can hydrate, have a good lifestyle, a good sleep up to 7 to 8 hours, good meals, avoid fasting, drinking plenty of fluids, doing exercise, avoiding the triggers like bright lights, loud noises, keeping stress-free, because stress is a very important trigger in migraine headaches, can help in avoiding the migraine. So that would be the first step. And once the second step, the treatment would include the NSAIDs, ibuprofen or diclofenac sodium, naproxen, triptans can be used in profound pain. And other things which can help in acute attack could be antiemetics like Zofran, Benadryl can help, and hydration would be the key. And later on, other medication which could be supplemented is magnesium, amitriptyline, which could be preventive for the migraine, topiramate, valproic acid, magnesium can help in prevention of the migraine headaches. And then the biofeedback techniques, the fourth thing, which will be the cognitive and behavioral therapy, which will help in avoiding the migraine headaches. So these are the 4 steps that can help treat, prevent, and avoid headaches and have a decent lifestyle for patients with migraine. I hope this video was useful for you. If you have learned anything from this video, please like it, share this video so that other people can learn from it, and subscribe to my channel. Thank you very much. Again, this is Dr. Babar from Kids Health Corner. May Allah bless all of us and help in our lives, and may God guide us to the straight path. Best of luck to you and your families. Sallallahu alaihi wa alihi wa sahbihi wa sallam. Thank you and Assalamu alaikum.